Morning and welcome to the show. The topic this morning is adolescent pregnancy, and we are fortunate to have with us as our guest Dr. Ellis, Cheryl Ellis, an associate professor at Middle Tennessee State University in Murfreesboro, Tennessee. Dr. Ellis, let me welcome you to the show this morning.
Thank you.
Dr. Ellis, one of the things that one of several things that we'd like to try to accomplish this morning is to talk about the problems that we have in terms of what we call adolescent pregnancy. I think at one time we called it teen pregnancy, but I think the age at which that was occurring dropped down below the teenage area, and now we have to call it something else. But let's talk about that as a problem this morning, and to talk about some of the things that we might be able to do in terms of dealing with that as a real problem. What are some of the problems that are generally associated with adolescent pregnancy?
One of the things that's associated with adolescent pregnancy is child abuse, low birth weight of babies. Many of the health problems and social problems that affect children are very, very prominent among the adolescent who has a child.
And so right up front, we're talking about some of the basic problems dealing with society. I think you mentioned the fact of child abuse and et cetera. Mm-hmm. Now, how is this a problem? And give us some information in terms of the ramifications of it. What does it actually mean?
It's a very vicious cycle. You have a 14 or 15-year-old who has a child. She does not normally continue high school. She does not have the information that she needs to raise a child. She has no parenting skills. So consequently, she may abuse her child. This child may grow up and become an adolescent mother, and hence you have the same cycle.
I think one of the things that you mentioned earlier was what we call tunnel myopia. Mm-hmm. Now, exactly what does that mean, and how does that fit into this as a issue that we're dealing with this morning?
Let's just break the word tunnel, which means narrow and focused, and myopia, which means nearsighted. I think, well, in my opinion, most of the people who are working with adolescents and trying to conquer this problem suffer from tunnel myopia. Their vision is very tunnel and is short-sighted. We tend to want to blame parents for this horrible problem. But how can we blame parents when parents haven't been educated themselves? And that's a form of tunnel myopia, saying that this is something that the parents should take care of. And it's not. It's a societal problem. It's something that we as a society need to deal with.
Well, now, how do we deal with it? I mean, it seems that on shows like this and other shows that we often talk about it as a problem. And it's been a problem that I'm familiar with over the last 20 years. Mm-hmm. And in some instances, it seems to be getting worse mm-hmm. instead of better. And yet, it seems that there is no solution. Now, as a person who has been involved in the professional aspect of solving it as a problem, what are some of the possibilities of dealing with it and bringing it under some kind of manageable proportion? Certainly we might not solve it, but how can we manage it?
The first thing that we have to do is to be very, very honest about this. What we're doing is not working. We have to admit that. Everything that we're doing now is not working. And one of the main things that we're doing is putting it in the laps of parents. The school, the clergy, the church, and other social institutions have to come together and say, we've got to do something different. We can't continue to do what we have been doing, and that's putting it in the laps of parents. One of the things that I think that we can do is to really implement some of the curricula that have been put out for our schools. K through 12 should have a good sex education program, but a lot of people go really crazy when you mention a sex education program in the schools, but we need that. Well, it needs to start in the kindergarten.
Well, as a matter of fact, I think that not long ago we spoke with Dr. Bailey of the Metro Health Department, and she indicated, as you're now indicating, that the schools are perhaps not doing as much as they should do. The church is not doing. Let's look at some of those problems from your perspective, which is to say she looked at it primarily from a medical profession, but let's look at it from sort of a social perspective. What should the schools do, and if you had the opportunity to, quote, dictate to schools in terms of solving this as a problem, what would you say to the schools this morning?
The first thing that I'd do would be to encourage them to start teaching human sexuality in kindergarten. Now, when we say human sexuality, it doesn't necessarily mean anatomy, but it means teaching little boys to respect little girls, teaching little boys that there are not two kinds of girls, a bad girl and a good girl, teaching little boys that there's just one kind of girl, your sister, your mother, the person that you're going to grow up and marry. Taking kids to the bathroom of the opposite sex and showing them the different utensils and equipment that's in the bathroom so they get acquainted with the differences in the body, so when they're 13 and 11, it won't be such a big mystery or a mystique about it.
Well, as a matter of fact, I think one of the things that we generally find is that this is also one of the contributing factors to what we call AIDS, that is teenage pregnancy and AIDS sort of intertwined. But now, in some instances, we find that there's quite a bit of opposition in terms of introducing our young people to an AIDS curriculum. And you mentioned the fact that we ought to start at kindergarten. But I think even some of the most progressive curriculums dealing with this as a problem will almost omit the first 2 or 3 grades, and they'll only start picking this up at the 4th grade. Now, what do you think about that as a problem?
I worked in a task force for the state of Tennessee, and we developed terminal objectives for kindergarten and 1st grade dealing with AIDS.
Now, how did that task force operate, and why don't you give us some information relative to that?
Oh, well, we got together and we just developed these objectives, and I think one of the objectives that we had for kindergarten was to just talk about the disease, not go into really deep detail about the disease, but talk about some of the things that the kids have heard on television. What we have to realize is that our children are being educated and, well, miseducated by the media, and we're not doing anything in our schools to combat that or to help our kids understand what the media is pushing on them. Our kindergarten kids know about AIDS. Don't you think?
Well, I would imagine
certainly they do. But it's a kind of education. That's right. They're not getting accurate information, and we have to do that in the schools.
Now, I think
and the state of Tennessee is prepared to do that. But each county, each school district has to opt to say that they're willing to use that curriculum.
And of course, you can make the curriculum, and you've already on this task force designed a curriculum that will deal with AIDS as an issue that could be discussed and used in the lower grades in kindergarten, but it's up to each school district to make that decision. Now, how many school districts, to your knowledge, have...
Very few. I don't know the exact numbers, but the problem is you have very undereducated people who are on some of these school boards. And I know I'm stepping on a lot of toes when I say that, but we do. They don't understand anything about the disease process itself. So, and they think that what's going to be taught are values and things like that. They really don't understand.
In other words, they've got a